Hey YouTubers, sorry I haven't been around for a while. I had my surgery and it's been, a little bit of something to get back to the swing of things. I went in on I drove down there. It's about 3 hours away where I had the surgery. Drove down there on Tuesday and did all the pre-op stuff, had to take the class on the diet and all that kind of stuff, and then surgery on Wednesday. Everything went okay, I guess. I mean, I'm here so that's a good thing, right? I had an old hernia that had been repaired about 2 years ago from an incisional hernia that I got from hysterectomy that I had a while ago. And it turns out that was all, the mesh that they put in was all enveloped in my bowel, and so they had to kind of rip that apart. So they kept me an extra day to make sure that, everything with my bowels were okay, and that turned out fine. So a little sore than I think normal, but, it had to be done. So as far as the diet goes, really, honestly, I don't think ever in my entire life have I not wanted to eat a meal so badly as I don't want to eat them now. It sounds really backwards, but I don't want to eat. It doesn't make me feel good. It makes me feel full, and I don't like that feeling. And I don't know if I never got that feeling when I was heavy or when I ate too much. I don't know. It's weird. But I'm thinking it's just really the pain, and this too shall pass, I guess. Overall, everything's been going fine. I have I don't know, I say it looks like I was stabbed with a butter knife. I've got, I think, 6 incisions, that are just, real short, and one that's a little bit longer and a little deeper, but, seems to be, healing all okay. I was glad they used glue instead of tape. And please excuse me because I don't know, I burp all the time now. All the time. Doesn't matter. I haven't had anything to eat for quite a while. I've been, trying to keep up with my fluids, but yeah, burping all the time. And I know that part of that is probably the gas, that they filled you up with and everything, but good Lord. Seriously, it's just enough, really. So yeah, that's a little troublesome, and it hurts because you're like burping, and that moves, your stomach muscles and all those things in there that are really, really sore. So, that's, kind of bothersome. Yes, gas, places other than my mouth too, but, those aren't nearly as painful for some odd reason. The fluids have been mildly difficult. I feel like I'm doing my best. It's hard because you can't drink for half an hour before you start, and half an hour before you eat, or half an hour after. So I've been setting a timer when I start eating for 60 minutes, and then it's supposed to take me half an hour to eat, which that's hard enough. And then I wait for half an hour after that. I'm supposed to get my milk in and supposed to get my juice in, and then unlimited water, and I'm finding a hard line between getting all the juice and all the milk and the water. So I really need to step that up. I know I do. But otherwise, as far as that goes, it's, could be worse, I guess. It could be a lot worse. So I don't know. That seems to be how that's going. As far as food goes, I did cottage cheese today. I'm not exactly sure if I'm supposed to have cottage cheese, but it tasted so good and went down really well, and I, chewed it really good, or gummed it really good. I'm not exactly sure what you say when you don't actually use your teeth. And so that was, it just tasted good. That's the biggest thing. It was just plain cottage cheese, that's all. And so if anybody, please help me here. Please help me. If anybody has any really great ways to get down I have to take like an over-the-counter like Prilosec, or you know, it's like a heartburn medicine. I also have to do the Citracal, or this, you know, big huge calcium pill. And well, I did the B12 is okay because I put it on my tongue and it doesn't taste bad. But I'm trying to take those in the morning, and this morning, I mean, I've tried all kinds of different ways. I tried with a little bit of my cereal. I've tried in just a little cup of juice that I could just, you know, kind of swallow. I don't know, just please help. Because this morning I took it with a little bit of cereal and I mixed a little bit of like fruit, baby food in with it just to kind of, you know, give it a little sweetness, because that Prilosec, oh my God, it's like the worst taste ever in the history of the world, I'm positive. I mean, I'm not joking, really. It's awful. And so I tried that, and it didn't even hit the back of my throat, and I was already throwing out my breakfast. So that was really horrible. So I didn't finish it. I know I should have found another way to do that, but I can't even put it in my mouth, and it's like I'm already throwing up from it. So I have to find out a better way. If you guys have any great ways, I know somebody said applesauce. I can't imagine that applesauce is going to be any different than my cereal or anything, but I think that's what I'm going to try tomorrow. I'm not really a big fan of yogurt. So, and yogurt, they said, is like a fluid, so it's not really, it doesn't really stay in your stomach as long as it should. And so I can't, you know, do that except for, I don't know, 30 minutes after I eat or whatever. So that's I think the thing that's giving me the most trouble right now is getting that vitamin down. The B12 is sublingual, I think they call it, and so it goes into my tongue. It doesn't taste bad, so I've usually been taking that right after I take the nastiness, and that seems to, you know, kind of do it a little bit. But this morning I couldn't even get the nastiness down. It was awful. I'm afraid to put it in something bigger that I would sip on, because then I'm afraid I won't sip on it at all. I'll just, you know, push it away because it's going to take too long to get it down. So yeah, help with that would be fantastic. Otherwise, yeah, just maybe some other ideas for food. I'm like over the cream soup and the, you know, I've done the squash soup and the pepper soup, those Campbell's, you know, cream soup kind of things. I've done a little bit of baby food, like green beans and pears. Yeah, I guess that's all I've really been eating of much of anything, I guess. I am just going to try and keep going, and hopefully I'll start feeling better, you know, as the time goes on, and get through this whole process. I have doctor's appointment on the 31st. I may have to change that because it's not really working in my schedule, kind of thing. So yeah, that's coming up. Then they'll switch me hopefully to the different foods that I can enjoy. I'm gonna keep up with the cottage cheese because that just tastes good, and that's all I think. So thank you for the subscribers, and I will keep up with watching all of your videos now that I'm home and I'm feeling up to sitting at the computer, or laying at the computer, whatever the case may be. And if there are any comments, please post them, and I will do the same for all of you. So yeah, thank you, and I hope you guys are doing good. Everybody who's, you know, going through probably exactly the same thing I am right now, I hope you guys feel better. So yeah, enjoy yourself.